Good morning, ladies and gentlemen. Good afternoon or good evening, wherever you're joining us from across the world. Thank you for joining us on this edition of the Scale webinar series organized by ACIOE Associates. My name is Emmanuel Effiong. I'm the project manager on Scale, Nigerian Scale project here at ACIOE Associates, so that we can make the most of this conversation. I'm going to be handing over the reins at this point to the monitoring and evaluation manager here at ACIOE Associates, Mr. Henry Joma, who will be moderating the session this morning. Mr. Henry, over to you, sir.
Thank you so much, Emmanuel. Thank you everyone for joining. Welcome to this webinar series. It promises to be interactive, informing, educating, and of course, it is our desire that at the end of this webinar series, you will learn a few things that could help improve your capacity to measure results coming out from your ideas. So I would like now to call on Mr. Ilya Johanna. He's the advocacy advisor at Scale, who will give us a few remarks.
Good morning, Henry, and good morning, everyone, for joining into this webinar. We count it great joy here to be able to come out with a number of topics and that will strengthen our advocacy practitioners to be able to do their work. And from the leadership of the project, we're excited the way so far we are moving as the resource partner is championing this cause. And I look forward to answering more or getting to understand beyond what we have already planned to happen in this webinar. Thank you very much. Over to you, Henry.
Thank you so much, Mr. Ilya. Wonderful insights from you. I would like to welcome Mr. Sonny Pulutie to proceed with his presentations. Thank you and welcome, Mr. Sonny.
Yes, good morning, everyone.
Good morning.
Henry, thank you for the introduction. And Mr. Effiong, too, thank you for co-opting me through this assignment. I'm happy to be part of this. I think we'll just proceed straight to the presentation. Okay, so the topic for this discussion, let me also first of all say that this discussion is going to ask for, from my side, I'm assuming it's going to take about an average of 40 minutes to do my presentation, then I can take questions and answer, but between 30 and 40 minutes anyway. So what we're looking at is the idea to result. How do you get an idea and get a result? How do you start from an idea to a result? And assessing the impact of advocacy campaign. That's the topic we're going to quickly look at. And I have outlined the following. Can we move to the next slide, please? Okay. We'll be looking at the content, we'll be looking at the objective, we'll look at the introduction, and we will look at understanding advocacy from the perspective of MIE, and we will look at measuring advocacy results. Then we will look at reporting results, and we'll now take question and answer. This forms the content of the discussion for this morning. Yes, the main objective for this discussion, though I call it objectives, but actually it's the main objective, is to build the capacity of participants to understand and use MIE for measuring results of advocacy activities and tracking policy outcomes. This is the overarching objective for this discussion. Other specific objectives will include also identifying how to scale or measure specific activities within an advocacy program. And also how majorly we're going to look up more on understanding how to construct what I normally call a meta framework for measuring advocacy program. Because one thing about this discussion, which is for me is very important, is that people think that MIE is the same everywhere. But when you have to do with advocacy, you have to be, there's a little difference between how you monitor or measure the activities and result of advocacy from when you are doing service delivery, monitoring and evaluation. I think that is the major learning that we want to focus on. And then how do we then measure the advocacy activities or result. One other thing that is important here is that advocacy has to do with change of attitude or behavior. So measuring advocacy in terms of attitude, in terms of behavior, in terms of attitude and all that is a bit difficult because you are dealing with human beings at that point. So how do we then construct results that will help us in measuring that whether we're making progress or we're not making progress? These are the objectives that we're going to quickly look at briefly in this discussion. Yes, next slide. Yes, planning for advocacy program. I just used it as an introduction. I'm sure all of you have been taught all this before now in terms of what you need when you are doing advocacy program. So you need to set your advocacy objectives. Then you need to choose the right advocacy approach or method or tool that you want to use to achieve the objective. And then you need to develop progress metrics. It's on this specific level, developing progress metrics, that we're going to be talking about monitoring and evaluation, which we might call also performance assessment scale. And there's two activities there, or two words that I think we should take home from here. One of them is the responsiveness, and another one is accountability. Responsiveness is that when you are doing advocacy, you expect that people you are advocating to should be able to respond to your advocacy approach or advocacy discussions or activities. Then when there's a response, then it's also require accountability. So these are the two things we're going to quickly look at when we get to the details of the discussion. Then you have to also decide on the appropriate evaluation or performance assessment technique or method. If you have decided on metrics in terms of the scales of how you want to measure your results, then how do you want to go about collecting information? Do you want to do it like a survey? Or do you want to do on a routine procedure when that you're going to be getting administrative data? Administrative data means that on daily basis or monthly basis, as you are doing your advocacy, you are generating your information and you are putting them in your system. Then at the end of the day, you can collect all that and use that to do assessment to judge or decide whether you are making progress or not. So at this level, these are what is required. Then you do an assessment, assess performance in terms of weighing between the resources you have used and what you have gotten. Is it, does it equate to the resources you have utilized? Does it equate to the result? Or you yourself that have done the advocacy, are you satisfied with the result you have gotten in terms of your approach, your methodology, your processes? And then you have to provide your reporting. Whether you want to use a scorecard, there are different pictorial ways of reporting to present a succinct report of what you have done that can convince people that you have actually done a job. Next slide, please. Okay, still on introduction. Evaluation of advocacy effort requires flexibility, which means that for you to evaluate an advocacy activity, you need to be very flexible. Don't base it on your strategies you use yesterday, and you're going to use it for today. What do I mean by yesterday and using it for today? Probably you did an advocacy for a particular project last year, and you were successful. And you think that you can actually adopt the entire process of evaluation into the new project you are doing. That you are going to be totally wrong. Because like I said, advocacy has to do with change of attitude and behavior. People differ, and environment and the context of where you are also working affect your what you do. So that's why it's required that each time you are conducting advocacy in terms of monitoring and evaluation, you need to be very flexible. And because successful advocacy activities can be measured in a range of ways, such as change in lives, behavior, attitude, and improved public policy implementation. There are different ways that result of advocacy can be measured. And that also requires that when you start your planning, from the planning process, we are going to go look at that later, you should be able to map out what are your results. What result are you expecting? It is what result are you expecting that is going to be used to measure you. And I always tell people, before you go into evaluation of advocacy program, first of all, find out what has the project planners or project implementer decided that's going to be the results, so that you don't carry your perception of the same program you measured years ago and use the result to measure another project. No, the people doing it should be able to tell you that. Understanding progress advocacy for the perspective of MIE. Why do we look at it this way? What's an advocacy for MIE? MIE has to tell you that MIE advocacy is not just an activity, but it's a result-oriented activity. We don't just want to carry an advocacy for advocacy's sake. We want to get a result. And those results must be positive results. So MIE is coming in. When you say you have done an advocacy, we're interested in getting results that are positive. So you must put this in your plan. Advocacy also uses resources. Therefore, we need to account for it. If you are using resources, there's a need for accounting for it. Resources need to be aligned with the results produced. So when we are doing advocacy evaluation, we also want to look at what resources you have used and what result have you produced. Then last part of it is that results need to be communicated to the understanding of the target audience. When you get your results, you must be able to present it in a way that your target audience will understand what you have done. Next slide. In MIE, we have 5 levels of results, starting from the inputs, the activities, output, outcomes, and impact. But here, let me quickly point out, yes, the topic we are dealing with is talking about impacts, but I left it that way because I think we should use it to learn also. In the monitoring and evaluation, impact assessment is not an ideal way of assessing your results when you do implementation of policies and programs. Why? Because impacts are not contributed, are not produced alone by a single project. Impacts most time are long-term results that are contributed by so many other projects. So if you want to assess the impact of your advocacy, you are going to really look at your contribution of the advocacy activity you have done to that result. But so at this level, I would prefer that we will focus more on the outputs and outcome indicators or outcome results. Output results and outcome results. This is the main one that we want to assess because your impact, you are not the only one contributing to the result of the impact. I don't want to go into the details. When we go into MIE, we'll have you, but outputs, input means what you need to do your work. Activities are how you organize what you need to do your work. And when you organize that, you produce immediate result you are producing is what we call the outputs. And that's why, for example, you do advocacy campaign or advocacy training. First of all, what you want to do is how many people were trained and all that. These are outputs. But the result of you, why are you training these people? That's the intent of your training them, is what we look at in terms of outcomes. If you train people on advocacy and you count the number, yes, this number were trained, that's good. But how many of those people were able to probably go to the extent of beginning to use the result of what you have done? That is the level of outcome. Can we move on, please, because of time? All right, this is where the discussion will mainly start for today. When you are doing advocacy programs, right from the planning stage, like I said earlier, you must first of all map out what you call your results, which will help you in when you get to the time you want to do the scaling or the assessment matrix to be able to project what are you going to measure. At the input level, you should be able to identify the resources that you need. If you outline them, what kind of program do you want to do? Who are the coordinators? What are there policies or laws that are required that you will needed to do your advocacy campaign? What supporting environment are available for you? You must outline these basic things. If you identify them concretely, these are the input you will need. So that when you want to do an assessment, you'll be able to precisely measure what resources that are available to you. Then when you have done that, you also need to map out from the activity level, what are the basic activities that are required or processes that are required in terms of the operation? Are you doing capacity building? What kind of training are you doing? Data collection and management method. How do you want to collect your data and information? Like I remember in the other slide I showed you, is it going to be a survey method? Is it going to be is it going to be an administrative data collection process and all that? Your reporting process. These are all you must identify from the beginning of your planning, which will help you in the assessment. Then you go into the output. You now begin to assess from your own plan level. If I have these resources and I take this action, what am I expected to produce? That's what you need to begin to identify. It's not at the time you are doing the activity or you are going to do assessment, you begin to assess how many people you are supposed to be training. No. From the planning level, you must have all that. Then who are the beneficiaries? What are their learning level that you want to identify? So then you now move on to what result are you expected to see? The campaign, the objective you have set out, and the campaign programs you have planned, what are the expected results or effects, that changes that you need to see? And remember that I said here, change in perception, attitude, behavior, ways of doing things. These are what you want to see. So you must outline them in the course of your plan. Otherwise, it will be difficult for you to measure. And if you don't outline them, if you bring people like us, who are MI expert, we might be measuring you on what you say you are not producing. So it is very important that you map out your result first in your plan. And the last part, like I said, is impact level, which has to do with the more of the long-term positive effect, which are both positive and negative. Like I said, in my own experience so far, I don't measure so much programs on impact level because a particular program alone cannot produce an impact. You can only contribute. Can we move on, please? Okay. Now, measuring advocacy results, performance assessment. To conduct an effective performance assessment, the need for relevant, high quality and timely information on past performance in terms of result achieved, money spent, and challenges is very, or are very important. What do I mean here? When you want to conduct an advocacy from the beginning after your plan, you need to also identify how do you want to take statistics or records of what is happening over the period in terms of how relevant is the information you have. Do you have a database already, for example, established to be generating those or to be storing your information? How do you want to get those information when there is need for an assessment? Or is it only when you want to do the assessment that you remember that you need to begin to get those records ready? No, that's what we're saying here, that for you to be able to do advocacy assessment, you must keep all your records intact and get ready at any point in time that you needed them to be used. Therefore, the basis of doing this requires developing key indicators to guide monitoring and evaluation. Now, for you to be able to assess your outcome or outcome performance or results, you need to develop indicators. Remember that we have mapped out what you want to see in terms of mapping of results. So at that level, you now begin to develop your what we call specific indicators that you want to measure. And always encourage people, please don't go for too many indicators when you are doing advocacy programs. Go for a fewer indicators that you think that once you get those results, you yourself will be happy that you have achieved some basic results. Then you have to develop your performance assessment matrix. Once you have done the indicator, then the next thing is to do your assessment matrix or scale. We will look at the metrics and the scale and how that work with what we have just discussed. Can we move on, please? Now, what are the indicators? What is an indicator? Indicator is a quantitative or qualitative factor or variable that provides a simple and reliable means to measure achievement, to reflect the changes connected to an intervention, or to help assess the performance of a development actor. Like I said, it's both quantitative and qualitative. I know that some people, when you see some indicator, they will only use percentage. It doesn't have to be percentage. There are perception indicators, which you have to also assess. And remember that advocacy in this case, you are more of looking at change of attitude and behavior. So how do you quantify that? But you have to get some perception statement that you can see. An example could be, probably you are doing advocacy for and it's for health in maybe on has to do with let's take an adolescent girls assessing health centers, and maybe in the community or in a state or in the local government, you discover that that policy doesn't seem to be working well, and you want to do an advocacy to be able to make people, to reorientate people, to bring people and to be able to make adolescent girls to be attending such facility. What will be your indicator in this case? It's not just the number of adolescents that are attending the facility that you need to measure, because the issue is not related with adolescents alone. It has to do with the issue of policymakers themselves making the environment favorable and inclusive that enable guests to attend. So if you look at the number of guests attending and there's no change in the policymakers' attitude or procedures of doing things, then you have not achieved results. So in the quantitative and qualitative indicator, you need to look at all that. And remember that when you are mapping your results, these are exactly what you need to look at. It's not just looking at adolescent girls attending health center. You are looking at what about the part of the policymakers? What about the part of the wards and the parents? Are you going to do a program that will help the parents and the policymaker to have a change of attitude towards encouraging the young girls to be able to attend it, to be able to utilize health facility? What about the health workers themselves? So it's not the number of people that are attending alone. It's had to do with the issue of change, the total result of how people had a change of mind and change of procedure that eventually encourage the participation of adolescents in the health center. That's how the indicator must be constructed. So you need to look at those facts, those results, and be able to tell yourself, what am I going to measure here? If I measure only the number of adolescents attending the class, the health center, I am missing out, because the resources I'm using covers both the parents, cover both the policymakers, cover both the health workers. So you need to look at how do you then have that indicators that will show that you have done some level of work in those areas. Can we move on, please? Now, developing performance metrics or scale. Remember, I mentioned the issue of responsiveness scale and accountability scale. One, if you are doing an advocacy, you expect a feedback. And that feedback has to do with responsiveness to what you're advocating for. Now, what you're advocating for require you to be able to have a baseline of the level of knowledge or the level or the status of the people that you are working with or you're going to be advocating to. If you have that basis, then you'll be able to set and map out to yourself, how do I then scale up in terms of if they are in this level, how would I know that they are moving from one level to the other? That is where I talk about what we call the meta construction of results. Meta construction of results in terms of monitoring and evaluation of advocacy program. Like I said earlier, please, advocacy monitoring and evaluation is totally different from just monitoring service delivery of health, of education, and all that. Then accountability has to do with the issue of the implementers of those projects, like the policymakers, need to be accountable, or the leaders in the community being accountable to the policies or the program they're advocating for. If there's a responsiveness, are they also accountable? These are the key areas that I think anytime you want to draw your advocacy metrics, you need to begin to look at. And we will learn a little looking at these two levels to be able to understand how to construct the indicators and the matrix on that. Can you move on, please, to the next slide? Okay. Thank you. This is just a sample copy, and it's not to be copied verbatim. Like I said, it's dependent on the program you are looking at. This is an example of an assessment of a skill looking at the responsive part. In one of the programs I was involved in for I think it's about 8 years ago now, or 10 years, we have to come up with, well, the program was to advocate or work with the policymakers to bring some changes in the area of adolescent girls and others in the communities. Now, the question is, how do we then assess ourselves if we are putting resources into doing advocacy, into working with the policymakers to bring changes? These are not what you can find in any document. They are not what you can find in any book to say, oh, it is percentage of this, 1 + 1. It's not, you can't find it anywhere. So what you need to do is to look at what are the main issues regarding what you're advocating for. In this case, we looked at about the key issues from the first column. If you look at the first column, you see what I call the main issues. I look at the financial reporting. I'm looking about responsiveness now, responsiveness scale now. The next one is stakeholders' access to financial reports, complaint and feedback mechanism. due process office, whether it's existing or not, procurement policy and law, communication and public information, leadership, then financial reporting. These are key features we identified in that program that we will need to address to be able to make changes in what we're advocating for. Now, the next one is, once you identify those key features, the next thing is, how will you then know that you are moving from one level to the other? If you are traveling from Abuja by road to Lokoja, there are mileage on the road. So you can be able to say, yes, I am 20 kilometers to Lokoja, or I'm 20 kilometers away from Abuja. But in this case, it's not, you can't find it in any book. So what do you need to do? Is to begin to look at, this is why you have to be constructive, looking at what then do you need to see as changes. Take for the first example I said, under the scale, we have scale 1 to 5. And I said there are no support system or structure for stakeholders to access information. Because what we were looking at that time was the responsiveness of the policymakers and the leaders in the community to the people that were working, the target stakeholders are the women, adolescent girls, and all that. So the first thing I constructed in this that we need to use to do a benchmarking and use it for subsequent assessment is that, one, there is no support system or structure for stakeholders to access information. Assumption. Second one is that a weak system exists for stakeholders to access information, often excluding groups like adolescent girls and people living with disability. Scale 3, a viable system exists for stakeholders, including adolescent girls and people living with disability to access information, but has been difficult to use it and get desired results. Fourth one is a viable system exists for stakeholders, including adolescent girls and people living with disability, to access information and get desired results, but stakeholders seldomly use it. Now, the last one, which is the highest level in terms of what we want to measure, is a system for stakeholders access information is institutionalized and frequently utilized by stakeholders to get desired results. Now, if you come down to financial reporting, you look at no formally created medium or structure in place for stakeholders to access policymakers and response and services providers. The scale 2 is saying structure exists but not being utilized. It is just a political structure. Stakeholders have no relationship at all. How, if you look at this scale, by time, because there's a handout on this particular scale, a PDF document that you can use. Each of these features, you need to look at it. You can have a scale up to 7, but in this case, we decided to do 5. You can have your own scale up to 3. So when you use it to do an assessment from the benchmarking before you start your policy analysis, then you now gives you and say, okay, let's say financial reporting. Maybe by the time you did your benchmarking before you, the baseline before you start your advocacy, they're at level 1, which means there's no formally created medium or structure in place for stakeholders to assess policymakers and service providers in terms of financial reporting. That's where they are. So when you start doing advocacy, you now begin to see if you move on to scale 2 or 3. But this scale, like I said, is based on the particular mapping of results that you've identified above. I know this is not just a 10 minutes discussion. It actually takes a few days to understand this, but this is what it means. You have to, first of all, identify and map out what we call a meta construction of your results to be able to assess performance. Don't just go and do advocacy performance using MIE result framework that others use. It does not give you the actual result you need, because this is what you need. It's more of qualitative and assessment. And when you do this, you can actually turn this to be quantitative assessment in terms of the scaling. Can you move on, please? So please take notes. I'll be ready to take your question. Then once you have done that judiciously in terms of that scale, then you need to present your results. I said there are many ways to write a report. Decide on the format you want to use. And secondly, that you must look at the must on capital, present a clear picture of achievement. If, for example, using that skill of responsiveness I just mentioned, and I'm going to do an analysis of what I've done, and I find out that from the financial reporting, I noticed that the communities or the policymakers I'm assessing has now started using giving access to people to have access to financial reporting based on advocacy activities I've done. How would I show that in my report? So use of resources, your money, your human, material, and technical must be reported. The use of charts and graphs and innovative approach to presenting results is also very important. You don't have to use this. When you are writing your report, please be innovative. Don't just consistently use one system or approach in presenting your report. If you use a graph where it applied, yes, that is good. You can also turn it to pictorial if possible. Then identify your challenges. There's no way you do a advocacy that you not face challenges. So we expect that when you do your report, you also present your report in terms of your challenges and make recommendations. And please don't allow it to be too voluminous. We don't expect you to do a report of, when you are doing an activity report, is different. But when you are doing an evaluation report, it must be succinct. Don't do a large report when you are producing your evaluation report. You can do your activity report and put appendix to your evaluation report, because what people want to see is your results, not your story of how you did it. What you have achieved is main result that you want to present. Yes, you can provide a link, a line of how that was achieved, but it must have to be very succinct. Thank you very much for listening to me.
Thank you so much, Mr. Sonny Kulutuye. It's been very insightful listening to you, especially learning from your own personal experiences. And this is very instructive that when people spend a lot of time working in this field, they become real experts. We are glad that you have shared things with us that are not just textbooks, they are very practical. And we are happy that many of our participants are actually showing some excitement about the insights you've shared with them. Once again, thank you so much for sharing with us. We have a number of questions in the question and answer box. People are asking a few questions. We would like that you take those questions. I will read them and get you to respond to each of those questions. All right. The first question is from Abdul. Abdul is asking Mr. Sonny, what are the things that entails operations, or if you like, operational stage in a project implementation, especially in regards to advocacy? So if you are implementing an advocacy program, what are the things that you are going to consider as things that you put in the operation stage?
Okay. The operations in this case, in terms of advocacy program, you that is going to conduct your advocacy program, you look at your own system. What are the resources that you need? What are your procedures and processes that are going to help you to implement your advocacy program? These are part of, when we do have evaluation, there's what we call process assessment. Also part of the evaluation we do. So in this case, we're just putting it together that when you want to do what constitute operation, in this case, is your procedures, your processes in your internal system that you're going to use in conducting your advocacy program.
Thank you so much, Mr. Sonny. And Yusuf Abdul, I hope that answers your question. If you got what Mr. Sonny has been saying from the beginning, when you do advocacy programs, you need to be as nimble as possible. You need to be as flexible as possible. He has just mentioned that what constitutes your own operations may be different from other person's own, depending on the items you are listing. Kemi has asked, are there any digital tools that one can use in advocacy? Are there any digital tools, any artificial intelligence tools that one can use for advocacy?
Okay. Yes, there are. There are some digital tools that you can use for advocacy. But remember that what we're looking at now is in terms of measuring your advocacy program. There are different IT facilities that are available over there that you can actually use. So many has been tested and found useful. These are some of the tools that you can use for your advocacy. But the problem is when you use those tools, how do you assess your result? That's what we're looking at this level. But there are. That's the answer.
What that means is if anyone have to use a specific tool, you will find a way to conform it to the results that you're looking for.
Exactly. Exactly.
Kemi, if you get that point, many of those tools may not be couched with your own program in mind. So if you pick up any of those tools, you need to
have to adapt them. Yes.
Yes, adapt it to your own program. Thank you so much, Mr. Sonny. There are a few more questions, and we would like you to answer those questions. How do you avoid bias when assessing your advocacy outcomes? So one of the participants is wondering, I may have my own personal bias, so I'm advocating in a certain line and I have certain bias that these are the kind of results I'm looking for. So how do I become more objective that my own bias is not showing off in what I'm?
Okay, thank you very much. That's why that's the essence of that meta construction of results. If you look at that scale that I provided as an example, if you constructively produce that scale in mind, because when you are producing that scale, you are not producing it as an organization alone. You are producing it with the mind that your stakeholders are going to help you to also assess it, to be able to say, yes, when we see this, this is a result. This is the situation we have. So when I produced that scale, for example, I presented, it went into various assessment. So many people made their input into it to be able to come up with that you are not biased in terms of the, but first of all, I will also say this. Advocacy, if you say you are not biased in advocacy, you are wrong from the MIE perspective. Can you take that? Very, very difficult to swallow. Because, yes, very difficult to swallow. You are doing advocacy. Why do you want to do that? Because you felt that there's a change you want to make. It's your perception. It is your perception. It is not a perception of the person that you want. It is you now who is going to convince the person or the implementer of the program that they need to make a change. So you must definitely, you already biased from the beginning by MIE assessment.
Absolutely.
Because you felt that, oh, this, you are going to a community, say they are drinking this water from this pool instead of drinking from this. So, and they tell you, I've gone to a community where they told us that, oh, this water is very clean and this water healed us, for example. But for you as somebody who got it, you know that borehole or tap water is better than that. How do you want to provide a process? You already biased. So that level of bias is also there. But you being objective, that your level of bias can actually be objectively measured is what is important.
Right. And especially when that bias is already backed by evidence.
Evidence, exactly. Thank you very much. So you cannot avoid the word of bias when you are doing advocacy.
I agree.
But it must be objective.
I agree with you. Absolutely. Absolutely. Someone equally asks, is it possible to first do issue identification, right, before an implementation, before establishing the indicators? So, you talked about establishing clear-cut indicators for your advocacy work. So should we first of all do the issue identification and draw up our implementation plan before we come up with the indicators?
Very well. You cannot draw indicators without knowing the issues. And you cannot start your planning of advocacy without knowing the issues. So it's the issues that you want to address that will inform your indicators too. So you must have to do that. That is it's vital. There's no need to talk much about that, but that's one of the basis of the planning, that you must identify your issues.
Absolutely. So, the topic of our discussion is ideas to resolve. But what you have explained actually shows that even though we're working from ideas to resolve, our planning should actually come from results to ideas.
Yes, that's one. The idea, I agree with you. Yes, thank you, Henry. The ideas in this case is carved on the point that you have identified an issue, and then you are providing an idea to solve the issue. So it's not, so example is that, let's take a practical example in Nigeria now. Petrol has been increased. And you discover that so many people are agitated, especially civil servants, people like us who does not earn salaries on a monthly basis, are finding it difficult now to go to work. And probably you have been contacted to come and how do we solve this problem using advocacy? Because a company have discovered that instead of recording 100% of number of workers coming to work, they are now getting at 40%. So what are you going to do? Before you suggest your idea, there's already an issue. So you must have an issue. Is the issue that will help you to identify what idea to be able to implement. And implementing that idea, when I'm saying when you have the idea, you must have the result at the point of identifying the idea. So that is one idea to result. Otherwise, the issue must be there. Without issue, then you cannot do advocacy. If there is no issue, there's no need for advocacy.
Absolutely. Thank you so much, Mr. Cornelio. These insights are wonderful, and we're excited to learn from your perspectives. Someone has equally asked, Joel has been raising up his hand all through the sessions, and he has asked a question. What are the steps? You know, Joel is very inquisitive, he's asking. So if we're doing M&E for advocacy, are there linear steps we are supposed to follow, or should it just happen? What will you advise?
Basically, M&E has a process. Yeah, if you call it linear process, yes, that's fine. But I know that M&E has some fundamental processes that you must take. But each of those processes differ. Like if you remember in course of my presentation, I said if you are doing M&E for a service delivery like health or for education, it's different from when you're doing M&E advocacy for health. A health practitioner who is probably want to go and construct a health center in the community. The advocacy, M&E approach in terms of what the result you are seeing is different from when you are doing advocacy for people to be able to utilize that health center. Do you understand my point? So there are procedures for M&E, and that's why I quickly call up that result chain. There's no time you want to do an M&E that you don't go through any of those result chain. But in terms of structural processes, I'm sure that's what you're calling linear process for M&E. There are different procedures, but there are fundamentals that you must go through. One of them is, for example, like I said, I'm sure you have heard of what we call the result framework. In this day, we'll talk about result framework, which is ROFM. Then, if you look at the monitoring and evaluation in terms of advocacy I mentioned, you are hearing about scale, which is different from result framework. Scale, because you have to use it, is more of a quantitative assessment that will help you to know whether you are moving from one level to the other. And that is constructed by you, who is going to be doing this advocacy. It's not me. You can consult people like us to help. This is an idea of what I want to do. We can help to frame this metal construction that will help you to guide you. But it's not the same thing as going to measure whether people are attending health center or whether the health center has been built and all that is different. I don't know what I've actually addressed your question.
Largely you have, and thank you so much. Oche, you are still raising up your hand. I will advise that you drop your concerns in the chat box and we'll pick it from there and the facilitator will respond to it accordingly. Yusuf asked the question, would you want to suggest to us any examples of qualitative indicators? So, you talked extensively about behaviors, that while you do advocacy, you should pay attention to the behaviors of all the stakeholders. And Yusuf is worried. Are there indicators to measure this qualitative data? You want to suggest any examples?
Okay. Like, remember that's why I brought up that scale, which for me, you need to pay attention to. And I mentioned very well that M&E has their structures in terms of result framework, specific indicators. If you look at that scale, all those activity, all those, each of those boxes are called indicators on their own in terms of advocacy monitoring. Because if you take one example, I don't know if we can flash that again at this level so that we can use to address this. Yeah. Now, let's look at financial reporting as a key feature of what we want to measure. Because the first one, where you have main issue here, I think there's something missing. There's supposed to be actually the structure, leadership structure in place. But let's take this, the financial reporting. If you look at the scale 1 under this financial reporting, it says no formally created medium or structure in place for stakeholders, assess policymakers, and service providers. This is for us in advocacy measurement. This is an indicator. If you look at the next level, structure exists but not being utilized. It is just a political structure. Stakeholders have no relationship at all. So you can see that if you say, yes, for your assessment in the financial reporting on that particular issues you are addressing from the perspective of what you are doing, that if people are at this level, scale 1, which says there's no formally created medium or structure in place for stakeholders to assess policymakers. That's where they are. So when you now start your advocacy, you now come back to do an assessment, you discover probably there are no more in 1, but there are now in 3, which shows structure exists, and the stakeholders are sometimes granted access to discuss their needs, but with little or no results. Yes, they are beginning to open up now for people to come and discuss their needs, but they are not taking the needs forward. That's where they are, as against where you started, where there is no structure at all. These are the qualitative indicators that could be used in terms of advocacy assessment. Now, like I said, it depending on the program and you have identified that you want to advocate for. We can go to the level also of having some other specific indicators that you can look at, like perception of people. These are indicators. You can also have indicators in terms of quantitative indicators relating to your own activity that you are carrying out. But for me, this particular scale gives you an idea and total conviction of what you want to do, that anybody who wants to come and assess you will use it to assess you. So in terms of specific indicators, it's depending on your activity that you are carrying out. Please don't go and import what somebody else is using and use it to measure yourself. That's where we have got it wrong totally in assessment and M&E. M&E has a structure, it has a process, yes, but always adapt what other people are using. I've gone to states to do some work and they say, oh, so state, this is what they are using. I say, okay, let's analyze it. By the time they begin to do the analysis, they discover that that indicator is no more relevant to them because they are not in the same context. They are not in the same environment. Gone are the days where we have conventional indicators, please. They are what we call conventional indicators, but those indicators must be domesticated to your programs you are doing. Don't just adapt it the way they are.
Absolutely, and that's the main idea of our conversation today.
Yes.
For you to translate your ideas to results, you must think about your ideas specifically.
Yes.
And Sonny had graciously reiterated that fact, that while you do advocacy, and that's the point you made, Mr. Sonny, when you equally mentioned that issue identification is very important, because your results are actually supposed to be tied to the issues that you have identified.
Exactly.
Thank you so much for the insights. We have a few more questions, and
okay,
we would like you to attend to them.
All right.
What are the key issues to identify in advocacy campaign? Are they supposed to be project specific? Benedict is asking. So do you just have to identify issues only on the basis of projects, or you can equally identify advocacy issues outside projects? You
can on both ways. Remember that I gave a particular example that if you identify, if you are going to do advocacy on adolescent girls' inability to utilize a health center, that is one particular project. But you can also, your campaign, your program will run around not only the girls, but you're looking at these policies that are available and the policy makers themselves. You're also looking at the parents and other. So policy identification, advocacy policy identification goes beyond just the project. It can look at other issues. It doesn't have to be project specific, but as long as there's an issue that needs to be addressed and needed a change of attitude and behavior, then you can do advocacy.
Actually, thank you so much, Mr. Sonny. And that's the idea of the scale project, that there are lots of issues that may not have specific projects designed to attend to them. Yeah. All we are trying to do in partnership with USAID, Palladium, and ACIOE is to build the capacity of different CSOs and business organizations that are able to identify issues within their localities and fashion out pathways to address those issues.
Address them, yeah.
Even without a specific project coming in your direction. Yeah, we want our society to be better, and as many issues we're able to identify within the society, once we have the capacity to develop pathways and to responding to those issues were encourage as many persons, individuals, and CSOs to use. Mr. Paul is asking, when advocating for the creation of budget lines at the local government level, for instance, when do you call it success? Is it when the budget line is created or when it is released?
Okay, one. The first question is, what is it? Why do you want budget line to be created? That is intent. That's where the outcome. Remember, I talked about output. For the fact that the budget line has been created, for me at that level is just an output. The outcome is that money has been voted in and being released. So when you are doing advocacy, it's not just advocacy to say, oh, because they can answer you. That's what my people say. I am from a village, now I'm a village man. They say yes, so that government can go. That's where they say it in my language, that when the tax collectors, those days used to come and collect tax from community people. Once they call anything, the government say, yes, sir, yes, sir, yes, sir. So at the end of the day, they will go. Once they go, so don't mind them. They've just gone. So creating advocacy, doing advocacy for budget line, they can say yes, and budget line is created with the budget head, but nothing is happening about it. Have you achieved your result? No. So the result at that level is only output level. Yes, budget line has been created, but has money been voted, as is money being released, that's where you are going to get your outcome in terms of budget line assessment.
All right. Thank you so much, Mr. Sunny. Very useful insights. Our participants are upbeat and a few more questions, if you don't mind. Thank you so much for the presentation. Mr. Jeremiah saying, thank you, sir, for the presentation. Looking at flexibility during advocacy, how do you manage? So you talked about flexibility a lot, and Jeremiah is wondering, if you have a restricted budget, will flexibility apply here?
Yes, it definitely applies. Flexibility does not mean changing your results. Flexibility means changing your strategy to get your results. That's the flexibility I'm talking about. Because from your planning, you have already identified what is going to be your result. That result, you don't need to change it, but you can change your strategies. You remember I also said that when we are doing assessment, we want to align your resources to your result. So flexibility in that case means, I will give you a practical example. This is more of a community level assessment. A project we went to do. We went to a community to do, in Plateau State, to do community planning in one particular community. And by the time we're supposed to spend 2 days in that community. The first day we got there was an epidemic of cholera, and so many people were done. And our vehicle was the first vehicle to go into that local government, in the Panshin local government. That day, we did not do planning because the planning was for the living and not for the dead. So what we did was we begin to evacuate people to go to the health center, and we have to call the commissioner because we have a link to make sure that people are alive so that we can do plan. That's the flexibility we're talking about. I'll just give that an example. Though it's going to impact in terms of your budget, whatever, but what we're thinking of is that you must manage it in a way that you can still produce your result. And by that singular act we did, I tell you that each time we get into that community, I want to stay the whole night, that people are ready to stay with us for the whole night. That's the flexibility I'm telling you.
And of course, because you are not in control of people's behavior, and
exactly.
Behavior has a lot of impact on the results.
Thank you. Yes.
Thank you so much. Someone asked that, Sonia had been talking about using scales as indicators when you are doing advocacy. And we were wondering if, like we mentioned, that this is a scale webinar series, whether the acronym is the same. No, the acronym is not the same. Scale is scale in terms of Sonia's presentation. He's talking about scale. But the acronym SCALE stands for Strengthening Civic Advocacy and Local Engagement. Right? Strengthening civic advocacy and local engagement. That's the acronym SCALE that you have been hearing all along. But in the presentation, SCALE is used for the word scale. And Joel again is asking, how can we analyze quantity indicators? Okay, any softwares for analysis, for quantitative analysis?
Yeah, there are so many softwares, so many. So many, and they're ordered. So many indicators. I mean, softwares. Ordinary Excel can also be used. That's what I always start. If you have not been using anyone, start with Excel. If you know how to manipulate Excel, it's go a long way in helping you in doing quantitative analysis rather. There are so many.
Hilda was worried. Hilda was worried when you talked about us dwelling on other two levels of results when you talked about output and outcome. And she was worried if using impact to measure the success of your advocacy is wrong, or if it has any disadvantages.
Like, what I mean is that, you know, I am coming from a professional perspective of MIA. So when we use the word impact from the background of MIA, we say that there's no particular project that you can actually assess or the result of that project using the word impact. Impact, in that case, you can use it, but you're only contributing to a significant result. So you can actually use it, but you must understand the level of what we are using it for. So that's why I said, instead, if you don't have a basic understanding of that, why don't you use the word result or use the word outcome? That's what I mean. Otherwise, you can use impact. But impact, from me, if we're doing impact assessment of a project, that we're only looking at how percentage, that we have to do quantitative analysis again, in terms of quantifying your level of contribution to the actual result. Let's take an example here. If you are talking about poverty in Nigeria, and you are doing assessment on that in part of programs on poverty, you remember that there's no single project that can reduce poverty, even if the agriculture, because we have done analysis and discovered that if somebody is not healthy, it's already significantly impacted on the level of poverty. Somebody who is not educated is already impacted in the level of education. I mean, the level of who's not educated is impacting in the level of poverty. So there are so many things that contribute to the impact assessment. That's what I mean. But if you understand it from the level you are using, so if you are using it, you must define it. For people like us, when we're coming, so we don't get you confused or get ourselves confused. Tell us what you want to assess when you're using the word impact.
Thank you. This is a very topical issue, and we have another question from Mohammed. Mohammed is asking, Mr. Sonny, please, what are the critical elements to be taken into account when conducting high-level advocacy to policymakers? Mohammed is someone who works in the WASH sector in the FCT, and he's wondering if there are specific critical elements he must put into consideration if he's taking up advocacy to high-level policymakers in the WASH sector.
Okay. One, there are critical elements that you need to consider. One of the critical, remember that, always have it in your mind that advocacy, like I said, has to do with change of behavior, attitude. You are dealing with human beings at that level to change their orientation. So the first thing you need to understand in terms of your construction of critical elements is, what is the context of the people? What is the context and the calibers of people? If you are saying high people, there are people who are very, very educated, but they are very ignorant of what you want to do. So knowing the knowledge level of these persons on what you are going to do is one level that you need. So you have to do what we call the political economy analysis of these persons. If you do the political economy analysis of these persons and know who they are and what are their likes and what they don't like, you will be able to come up with how to design your strategy to approach them. There are some people also that are there that will tell you that we have been working on this for a long time, so you can't teach them anything. You can't convince them. So at that level, what are you going to do? But having understanding of who they are critical. So I cannot tell you that you must line into 1 to 5 or 1 to 20, but the basic thing is that understand the context of the people. Do a critical political economy analysis of these persons. These are the procedures we use in identifying how to approach high caliber persons.
Thanks so much, Mr. Sonny, for the insights from the questions. We are hoping that many of you who ask questions, you are satisfied about the response you have received. Thank you so much once again. We have learned a lot, some new perspectives gained from your own experiences and talking about responsiveness and accountability. I'm sure this is something quite new to many of us, that we need to look at how responsive the critical stakeholders are, and how accountable to the process they are. Thank you so much again, Mr. Sonny. We are hoping that we'll call you for subsequent series and you will not hesitate to be part of it. Because this is a very topical issue. A lot of people are playing in the advocacy sector, and we get really worried that the results don't come the way we perceive that they will come, and so many persons feel frustrated and they run away from doing advocacy. And you could equally see someone pointing out the fact that, obviously, from what I learned from that question, that there are lots of issues in their environment that they need to pay attention to, but there are no projects designed to attend to those issues. So I'm sure many of them will take that from today, that they too can go back, design solutions for those issues that they've identified, whether there's a project or not. I want to thank you so much for being part of it, all of you who have been there. I appreciate you. Thank you so much. I would like to call on Emmanuel now for his closing remarks before we leave.
Wow, what an insightful and enlightening session. Thank you, Henry, for being a brilliant moderator. Thank you, Mr. Sonny, for the expert facilitation and for taking out the time to diligently answer all the questions. Thank you, participants, for engaging, making the Q&A very engaging, making us to explore further the areas of the subject matter that wasn't necessarily covered during the facilitation. Thank you also to our advocacy and engagement advisor, Ms. Elia, for staying on through the webinar. It has been a pleasure on behalf of ACIOE to bring this webinar to us, to all of us in participation and the larger civil society as a whole. My name is Emmanuel Effiong. Again, I'm the project manager here at ACIOE Associates. Until we meet ourselves next time, as always, keep working, keep advocating, and I wish us all the best. Thank you and bye-bye.